for joining us this morning. What a beautiful morning. I hope everybody got a little vitamin D and a little walk-in before we started this morning. If not, I give you permission to take a break after this meeting to go and get some vitamin D. So without any further ado, first, thank you, Tanya, for helping get this all coordinated, and thanks to Dr. Stone. And I'm sorry, I'm going to call you Dr. Dan because I don't want to mess up your last name, but I believe it's Riccutio. Is that correct?
Riccutio. Thank you. Dr. Dan is fine. Everybody
Dr. Dan. I'm all about keeping things simple for myself. So thank you for taking time. I know it's an incredibly busy time in healthcare, and I will speak on behalf of myself, our membership of over 400 people, and everybody on this call today, and say thank you for everything you're doing to keep us safe and healthy. And I hope you're managing to take a little bit of time for your own self-care, and we'll move forward. So today we have the honor of having Dr. Riccutio and Dr. Stone here to take a closer look at the COVID-19. They will discuss the current plan for the future, the impact of the vaccines, and the new variant strands. Before I start, please make sure you have your microphones off. We have been forwarded questions to ask the doctors beforehand, but if you have any, please make sure you put them in the chat, and we'll try to get to them best we can. If we can't, then we'll take note of them, and maybe we can send them off to the doctors for some follow-up responses. So I'm going to take a moment and introduce both our speakers, and then I will hand it over to you to figure out who's going to speak first and who's going to say what. So Dr. Stone is a family physician who has delivered care to patients at Lakeridge Health since 1992. His activities have included emergency medicine, inpatient care, palliative care, and low-risk obstetrics. His community practice is located in Bowmanville. He is active in the community and has taken on numerous healthcare leadership roles, including posts as president of the Durham Medical Society and president of the Medical Staff Association for Lakeridge Health. Prior to the formation of Lakeridge Health, Tony also served as chief of staff for Memorial Hospital, Bowmanville. Throughout the COVID-19 pandemic, Dr. Stone has served as co-chair for the Durham Region COVID-19 Steering Committee. Dr. Stone and his family have resided in Durham Region since 1970. Dr. Dan is an infectious diseases specialist at Lakeridge Health. He is a medical director for infection prevention and control and chief medical director for quality and patient experience. He has also been involved in the development antimicrobial stewardship programs on a regional and provincial level as co-chair of the Public Health Ontario Antimicrobial Stewardship Advisory Committee. He has been involved in pandemic preparedness at Lakeridge Health since January 2020. Through his role in the IPAC, and as a member of the COVID response team, and also as a member of the Durham Regional COVID Response Committee. He is currently an adjunct assistant professor at Queen's University and the University of Toronto, with an ongoing interest in quality improvement research with a focus on infection control and antimicrobial stewardship. I have to say, I'm a trained Toastmaster, and it's not okay to read your notes the way I just did, but there is no way I ever would have memorized all of that. So join me, everybody, in welcoming these outstanding men in our community. And I will hand it over to both of you, and we will patiently listen and learn, and then we'll fire some questions at you.
Dan, do you want to put the deck up? And I'm going to actually have Dan do most of the speaking. I am in my office at the hospital, and as you can hear, there's something on the other side of the wall that's going to be a problem. So, Dan?
For sure. You know, and I'm just realizing that, someone read my mind and made me co-host. Okay, I wasn't able to share. Here we go. Okay. Hopefully you can see that. Actually, maybe I'll just go to presentation view. Can you see that?
Yes.
Is it in presentation view? You can see the full screen?
Oh, Dan, we could, before it was full screen, now we have the slides across the bottom.
Hmm.
There, that's good.
Okay, you know what, I'll just, we'll just go with it like this. And if there's anything we need to enlarge, we can enlarge. So thank you all for having me. And for allowing us to come and present some of this data. I put some slides together, but they're a really high level overview. And I think what I've noticed from previous discussions like this is that there are a lot of questions that come up, and sometimes just having a conversation around the questions is even better than going through slides, as it's a little more engaging and can really get to the meat of what you guys want to hear. So a bit of an update just with what's happening in Durham at this point in time. And really this is a reflection of also what is happening in Toronto. We kind of went through a bit of a scary period in late December into January with cases increasing across the province, quite significantly, peaking in early January and across the province, if you recall. We had about 4,000 cases or more a day at one point in January before the lockdown, and in Durham we even hit over 200 cases diagnosed in a day, which in Durham works out to about 200 per 100,000 per week, which is a very high rate. And just compare that to, if you remember, last summer, which now seems so glorious, even though we were still in the middle of the pandemic. We were having like some days with like 2 cases, and the rate was like 2 to 4 per 100,000. So we had 10 times the number of cases in January. The lockdown occurred, across the province, as you know, quite dramatic, but also did work in that the number of cases decreased quite significantly to the point where we're now in Durham at around 30 to 40 cases per 100,000 per week. And this is significantly lower than the peak, also still significantly higher than it was last summer. And I will say that at this point, this graph doesn't show it really well, but we've kind of plateaued over the last couple of weeks. We haven't really continued that downward trend. We've sort of stayed flat. And I'll show you just a visualization of what was happening, what we were feeling in the hospitals. This is provincial data, but I think reflects well and what was happening at Lakeridge as well, is that as those cases started to increase in the community, the number of admissions started to increase. So the orange is the inpatient beds, so that's all patients, and then the red is the ICU cases as well. And we saw that come down quite significantly after the peak. So the number of admissions, COVID admissions, went down. However, we've sort of plateaued with both of these measures as well. This is from a couple of weeks ago, but we're a little bit lower with respect to hospitalized patients overall, but the ICU numbers have not really come down significantly. Across the province, there's about 750 ICU beds, maybe a little bit more with increased capacity. We at one point were at about 440 patients that were admitted with COVID-related illness. We're now down around 330, but that number is sort of staying steady. And really what I want to get to is that at this point, we're not yet out of the woods in that we don't have a lot of reserve capacity. So hopefully things are going in the right direction, but just wanted to talk about, where, and I think one of the questions, like, where are we going at this point in time? I think the overall trend has been good over the last couple of months, and it's encouraging. There's a little bit of concern with the flattening. And then one big question I wanted to bring up that keeps getting mentioned is with these variant strains. So just to give a bit of a background, the variants are basically viruses, the COVID virus that has a mutation. And any virus can form a mutation, especially when the virus is circulating very broadly quickly. And some viruses tend to mutate more than others. So like influenza, for instance, mutates at a very rapid rate. And, every year we have, very or significantly different viruses whereby the vaccines need to change in order to try and cover that. And even with that, it gets a little bit tricky. Coronaviruses, which is like COVID, they tend not to mutate as frequently. The mutations don't happen as often, but they still happen. So what usually happens is when the virus mutates, the mutation either results in a virus that doesn't cause any different illness or even becomes less fit, and so that virus goes away. But every once in a while, there's a mutation that happens in a particular piece of the virus where it actually changes the way the virus behaves, and it changes it sort of for the worse for us or for the better for the virus. And so a couple of these have popped up recently. Initially sort of reported in December, but probably present in the fall is this UK variant. Trying not to name it after the geography, but the nomenclature gets a little bit tricky. This is also known as B117. And this one started to spread across the UK, including England and Ireland, and then now across Europe in quite significant numbers, and now it's really spread across much of the world with increasing numbers. I'll talk about what's happening here. Part of the reason why this one is taking over and spreading is it is more infectious. And there's some recent data suggesting that it is associated with increased viral load, meaning that you have a higher level of virus that you're shedding if you get infected with this strain. And so that means that you can potentially transmit it to others more effectively. There's also some suggestion about an increased mortality. That data is not totally clear. This comes out of the UK. There might be other factors that resulted in the higher mortality, but that's a definite possibility. One thing to note about this strain is it does seem to be protected, or the vaccines seem to be protective against this strain. So those vaccines that are currently available that have been approved, which we'll talk about a little bit more, seem to protect against the UK variant, which is good. There's two other strains to talk about. So one is called B1351, or they call it 501YV2. So this is that South Africa strain. And then there's one P1 out of Brazil. These have similar changes to the UK variant, and so they're probably more transmissible, so they can shed or spread a little bit better, more effectively. And the main concern with these is that there's a mutation that alters the spike protein, and the spike protein of the virus is the I didn't show a picture of the virus here, but it is the little spike that sticks out from the top of the virus that then attaches to your cells and enables the virus to get into your cells. And that is also where the vaccines work. So they actually work against that spike protein where antibodies try and bind to it. And these variants have a mutation in that spike protein that changes the shape of it, so that it may be that the vaccines are not quite as effective. There's still some effectiveness, but probably not quite as effective. And that's at least with data with the Johnson & Johnson vaccine, as well as the AstraZeneca vaccine, and this other one that's not approved in Canada called Novavax. There's also evidence that, for instance, in Brazil right now, which is struggling once again with really high numbers of cases, that these variants are able to spread even if you've had previous infection. So that is obviously a concern going forward. There, with the mRNA vaccines, the Pfizer vaccine and the Mrna vaccine, we don't have real world data on these yet as to how effective they are. There is some data from the lab that may suggest they're not quite as effective, but probably still offer some coverage. So I'm not sure, is there a question on this? I have been Zoom difficulties here. I thought I saw something in the chat box, but. Okay, looks like we're okay. I'll just.
Hey, Dan, just flagging for you. I just wonder how much, it's 9:15. I just wanted to know in terms of timing and getting through the deck and including the vaccine discussion, leaving time for questions. Just wanted to flag the time for you, that's all.
Okay, thank you. Yeah, perfect. Um, so then I'll just skip over to where we are with these variant strains and what they might mean for us here. As of now, or this is from a couple of days ago, we've been seeing a increase in the percentage of the strains being detected in Ontario, including Durham, being the variant strains. Most of them are that B117 UK variant, and what we're seeing is about 35% of all the strains now are this variant strain. And so although the overall number of cases are flat, the variant strains are increasing. The concern here is that if they are 50% more infectious, that once the variant strains become a majority of the overall number, then our cases will start to rise again. And I think this is what most of the modeling shows as well, unless you can really impact that by public health measures and vaccination. And so that's really the big if, is can we keep things quiet enough so that we can get through the spring, get enough people vaccinated, and prevent another wave going forward. So maybe on that, I will just provide a little bit of update on vaccines. And I won't get into the nitty gritty too much on the different types of vaccines, but just to say that, as a background, how vaccines work is really tricking your immune system into previously recognizing a virus. So it's basically, or not just a virus, but another infection. So it's basically presenting your immune system with usually a piece of the infection, either the virus or the bacteria, where you then, your immune system, when encountered with the real thing, will have the memory to produce antibodies and other cells that can then target that infection. There's different ways of doing it. So common ways that, for instance, influenza vaccination actually use the whole virus, and it's either inactivated or what's called attenuated. This is like the measles virus, where they take the measles virus, but they make it weak so that it doesn't cause problems, but you still mount an immune response to it. There's some that are just pieces of protein. And so the coronavirus one is called Novavax. And basically they take the spike protein and they inject that. So doesn't cause COVID, but it'll cause an immune response to that spike protein. This is like the tetanus vaccine. There are some that use viruses. And so this is the Johnson & Johnson or Janssen vaccine, as well as the Oxford AstraZeneca vaccine. They actually use a different type of virus that is not harmful to humans, that actually brings the code for the spike protein into your body, and you mount an immune response against that spike protein. And then the others are genetic vaccines, and that's where the mRNA vaccines come in. They actually get your body, they give your body the code for the protein, and your body actually makes the protein. So your own cells are making the spike protein, and then your body's having an immune response. There's lots of reasons why this has been, a good way of doing this. One is that they're relatively easy to manufacture on quickly, so you can actually change what the code is, and it also allows for mass manufacturing, and it's a lot easier to do than, for instance, growing a virus, which often requires cells and just the infrastructure is much more difficult. So I won't go into too much on this, but these are from the phase 3 studies. These are the data for most of the vaccines that are either already approved. So these first 4 are now Health Canada approved. We've only really had the Pfizer and Mrna vaccine in action, but the AstraZeneca and J&J are coming. Novavax probably will be approved. That one's not yet out yet. And they have some varying protection from mild to moderate disease. The studies have been conducted, though, over different periods of time and in different countries. So it makes it pretty difficult to compare these numbers against each of the vaccines. So for instance, Pfizer and Moderna were done much earlier when there were no variants circulating. AstraZeneca was done in a few different countries, same with the J&J and Novavax vaccines. I think maybe what we want to focus on here is that all of the vaccines work really well at preventing people from getting severe disease and from preventing death. And this is both shown in in the vaccine trials, and now there's been hundreds of millions of doses given of vaccines across the world. It's been shown in the real world effectiveness as well. So I think that the gist of it is that all of these vaccines can keep people safe, can turn even if you do get mild to moderate disease, can turn COVID from something deadly to something less severe or less deadly, and keep people out of hospital. So I don't know if Tony, if you want to talk about the vaccine distribution plan at all, and or the rollout in Durham, I can keep going, or it's up to you.
Yeah, sure. I'll jump in. I just want to add to the last slide, though, to reinforce what Dan is saying. It's so important that that it is understood that the emerging data suggests that all the approved vaccines prevent severe illness and or by and large, and hospitalization and death. So that if someone was going to get hospitalized or in the ICU or worse, died, that might look more like a cold or influenza, or even a severe influenza in severity, as opposed to what we have been seeing with this virus. So important that we know that they're similar in terms of that benefit. With respect to the vaccination, I think, folks, it's going to be very important to stay looking at the region of Durham vaccine page that they have. By and large, the region of Durham is, and all public health units, I shouldn't say region of Durham, I should say public health, Durham Region Health Department, but all public health units in Ontario are the ones who hold the primary accountability for vaccine distribution. And there's all kinds of help with administration, but vaccine distribution is their work primarily. So the hospital is determined to do its role in helping and participate. We are right now running this, operating the mass vaccine clinic in North Oshawa at Ontario Tech at the arena. I think that now there's two others. There's the clinic that's opened in Pickering, at the Pickering Rec Center, and then there's one that which would be very important to the Clarington Board of Trade, that's opened or opening. I'm trying to remember if it was today. It was the first day at Garnet Rickard. So that's really, really good news. The intent, of course, is to open vaccination centers in all municipalities. So where we are in terms of phase one is, I think you've just seen all the recent announcements. So not only is there opportunity for the 80+ crowd in the community to book, all of the remainder of folks in phase one, that includes folks who are less than 80 who live with chronic conditions, and then they listed 24 categories yesterday. So folks on chronic home care, Indigenous in our community, all of phase one is now able to book. We are in the midst of a transition into phase two, and the idea really is to get vaccines out as quickly as they're being delivered, and then transition into phase two and progress through phase two. And what will happen is, beyond what I just described for phase one, there's this intent to go in 5-year increments with phase two. Now, just to nuance this a bit, I'm talking to you about the vaccination clinics that are going to be run all across Durham region, which I think the bulk of vaccines, that's going to be the bulk of vaccine distribution for the next several months. With the AstraZeneca, we're all hearing, and I hear it at the same time you hear it, that it looks like pharmacies are going to be used to distribute the AstraZeneca, because it doesn't have the same cold chain requirements. There's a focus on age 60 to 64, but what exactly happens with the ultimately with the AstraZeneca and then the J&J, assuming that we start to see J&J roll in the next month or two, I think it's not completely clear, how those vaccines will be distributed. It makes sense, though, that those vaccines will likely be distributed through the regular channels that you're used to, meaning primary care and pharmacy, because they can be stored in a standard way. But I think what's really important that you want to know is here we are, vaccines are really ramping up. We're going to complete all of phase 1, transition through phase 2. And the transition means that we don't want the clinics to be empty, like to finish up one age group and then be underbooked. It'll be just this progression that you can imagine makes perfect sense. So Dan, if you move through, I think that there's some really good data, more data on vaccine effectiveness. I'm not going to speak to the data specifically, except to say this: if you look at the Durham the COVID data tracker, you will note that the number of outbreaks in long-term care and retirement has really come down very well. In fact, when I last checked yesterday, I couldn't identify any active cases among residents of long-term care or retirement. There were a few cases among staff, but not many. So I think that's very impressive and gives us confidence about the number one, we're protecting this vulnerable group. Number two, the effectiveness of the vaccine. Next slide, Dan. This is a really good slide to end on because it always is worth circling back to our personal and individual accountabilities. As we all suffer with pandemic fatigue, I think the day before or 2 days before the anniversary of the pandemic hitting Ontario, one of the things that we all struggle with is the intensity of the rules personally, but the fact that the rules really work well. All the basics around masking with a high quality mask. And I think folks, if you don't know, Dan has a link to that. It's high quality mask, the distancing, the hand hygiene. I think there's more and more talk, especially as the weather warms, about how we can engage each other, at least for now, out of doors, if we're going for walks and so on. But really how we don't mix households and how we do all the things that are critical to minimizing the spread. Because if you look at the data, we know that, the highest risk of infection is a secondary infection in your own home. So I think, the key focus for me, especially with the variants, because we know the variants transmit more easily. We know it. And so if we can all hang in there till we all get vaccinated up, it's critical. We do depend on the province to execute on the broad measures, and you guys are all familiar with all the different sequencing from green through red through gray through lockdown. We depend on them to make those determinations. But if we here in Clarington and in Durham do our part, I actually think we will help control, because we know the basics make a difference. So I'm going to quit there, and there's probably lots of questions and for Dan and maybe some for me.
That's great. Lots of really important information for us there. Thanks, guys, for joining us. So we do have some questions that were sent in advance. Make sure I'm off mute. And so I'm going to sort of group some of them so that we're not repeating our questions. So there's a lot of questions that came in regarding seniors and different gathering environments for seniors, like the senior centers, Wilmot Creek, local apartments that are focused on senior living that maybe aren't long-term care. Is there a path forward for them in how, or a way that those groups could support hosting a vaccine clinic or helping get those vaccines into arms?
So aside from the main mass vaccination clinics, there are a number of mobile vaccination units that have been created to target vulnerable populations across Durham. And that's being driven by the health department and with paramedicine. So what I would say is I think there's a path to asking those questions through the health department around where are the mobile units going to be. And I don't have the answers on the specifics one thing we know for sure is what we don't want to do is fall short on making sure we capture everybody. So I think what I'm still looking for is to make it a clear, easy path for these questions to be answered. And I've had some questions already that I've redirected to public health. I think that the mobile unit issue is really what you're wondering about. These vaccines that we're using, they require very careful cold chain management. So they're not simple for transport and use in multiple locations. That said, I think it is really about the mobile testing strategy in Durham, and who are the groups that are what are the locations and the groups being targeted, and how do you know if a particular senior's apartment or some other location would be included in that, or even if it could be. So it's not a really clear answer, but I think it is really about understanding where and how mobile units are being organized in Durham.
Okay, great. There's also clearly our demographics are being demonstrated in some of these questions. So for those people under 80, maybe over 60, wondering about that second phase, and I'll sort of throw in also for patients with immunodeficiency health issues or complicated health issues. As that next phase rolls in, like how will they fit in? Will primary care physicians have some input into prioritizing their patients in any way?
I'll start and Dan can jump in. So as I mentioned, just for clarity, what has been happening is there's been a dependence on using social media and mass media to get this out. I would say that there still isn't great clarity. Lots of folks are asking questions like this because the messages aren't clear to everybody. But it would be helpful if the Board of Trade and its members were really encouraging folks to go to the vaccine page at the Durham Regional Health Department website. It's critical because it starts to give info on the sequencing and when you can start registering and basically what happens. So for example, anyone over the age of 80 can register now. Very shortly, anyone over the age of 75 can register. And for clarity, folks will want to know this. The way they've decided to do it is if you're for those who are turning 80 this year by December 31st, you can register. So if you're 79, you go ahead. Once they drop 5 years and they start to register everyone over the age of 75, the same rule applies, so long as you turn 75 by December 31st, and so on. So the website, I think, will help people to know, okay, when is my age group now eligible to register? Again, it should be in the news media, it should be on social media, but I would direct you to the website. They're also for folks who don't have access to internet, don't use those computers or those sources. There is a phone number, and I don't think we published it here, but I can easily get it to you. But there's a phone number to call. That there's a call center number that enables folks to be registered. Where primary care is concerned, primary care will be providing a lot of vaccinators to these clinics. Because of the cold chain issues for Pfizer and Mrna, I don't see those vaccines really entering into primary care for several months. That really becomes a tricky issue to manage, right? And how you transport those vaccines. For sure, I see primary care as active in giving advice to their individual patients. I see primary care as critical as vaccinators in the clinics. Primary care will be critical later in phase 2 and all through phase 3, and particularly with the vaccines that don't require the complex cold storage. And I think Dan just put in the chat for folks the call center booking number So please, folks, if you can distribute this information, get people to go to the vaccine website, for get people to all advertise the booking number, for the call center, because those who are computer savvy can do this online. Those who are not, just call the call center. But that's, I think, really the process that everyone needs to follow. So hopefully I've answered the question, and I don't know if Dan has more to add.
Maybe just to add that these discussions with respect to the involvement of family physicians, primary care is ongoing. The Associate Medical Officer of Health and I will be giving a presentation next week to primary care in the region through the OMA as well, and discussing some of these. Going forward, there likely will be more involvement of primary care in identifying any patients on roster that may meet criteria, and the criteria though will be set centrally, as Tony said, through the public health units, and will be rolled out in phase, but certainly I think primary care will be instrumental in reaching their patients. Sometimes this is the main link, right, to healthcare that people have, and really look to their primary care practitioners as sort of the go-to source. So we want to make sure we utilize that regionally as well.
That's great. Thank you. We'll patiently wait our turns and make sure that we're sharing the words with our far-reaching.
Should we interrupt?
Yes.
The one thing that was part of your question, I just wanted to reinforce, is those with chronic medical conditions, and the province listed 24 yesterday. Those with chronic medical conditions may start registering now. That's what I heard yesterday. Dan, I don't know if you have access to those conditions, but again, there's the age progression, and then there are those who have existing medical conditions, which I think we would want to make sure that was well understood across our community.
Yeah, that's a good point. Thank you for clarifying that. So I have one more question about vaccines, and then I'm going to move on to some more human nature questions and helping us understand what we're allowed to do and what we're not. So we have a question here. Is there any indication on how often we will have to be vaccinated? Will it be an annual or a one-time shot? And if not, what's the best guess?
Mm-hmm. So I can take that one. I think we likely will require more vaccines. Whether or not it's annual and for how long, it's hard to tell. But that's part of the reason why I talked about those variant strains, where the strains are just different enough that these vaccines, which were directed against sort of the original strain, don't work quite as well. Now, there's already, Pfizer and Mrna and Novavax, these companies that have already rolled out the current vaccines, have already developed a modified vaccine that should work against these strains, and they're in the early phases of testing these just to make sure that they're safe. So very likely there will be at least one booster. Again, I don't know if we call it a booster, but a subsequent vaccine sometime next year to just have better protection against, for instance, some of these variant strains. Whether or not we actually need to do that again and again really depends on if we can keep the virus transmission low enough across the world so that these variants don't emerge, and if there's no new variants emerging, then we may be okay with the current vaccine. This is maybe a bit of a it's a hope, but there are some companies working on what they call a pan-coronavirus vaccine, which would mean that it works for all coronaviruses. And this is by targeting very specific parts of the virus that don't change, that can't mutate. And so that's in the works too. So if one of those works, then you may be good with just one more vaccine, after the fact. So I'd say definitely there'll be another. Whether or not there's any more after that, I think we'll have to wait and see. That said, it is still the right thing to do to get your vaccine despite the variants. It is going to work against the variants, maybe just not as good as the parent strain. And we will be able to drive down. So even if it works 50%, if you can stop the spread of a variant by 50%, the chances that you can keep it from really circulating are much, much, much higher. So the right thing to do is really to get out there and get vaccinated. And this is really, this, along with the spring emerging and still trying to keep up with some of the infection control practices over the next little while here are really what's going to get us into, hopefully a much better summer and fall and more calm, next year or next winter.
Great. So this is a bit of a bridge question. So when I am vaccinated, is it correct that I would still be able to carry the virus and infect others who have maybe not been vaccinated yet? And is there a threshold of time where it becomes more safe?
Yeah, so I think overall it becomes much more safe. And you probably heard from the CDC announcements yesterday, they're actually making some recommendations that people who've been vaccinated within a household can actually gather. They recognize, if you read their actual statement and the evidence around that it's not zero risk. There is the potential risk of transmitting these variants, for instance. I think what they're weighing is, it's probably a little bit different than in Canada, where some places are already recommending to stop masking. And I think they're thinking, like, if we can at least get people vaccinated, that at least decreases the risk overall significantly. We now have emerging data suggesting that not only do the vaccines save lives, decrease hospitalizations and death, but also decrease the amount of virus that you shed. So make transmission less likely. It's not zero, but make it less likely, and probably also protect against asymptomatic infection. So it's not just 95% against symptomatic infection. There's protection against asymptomatic. It may not be 95% effective against asymptomatic. We don't have the details there, but it seems to work across the whole spectrum. And I would say similar to what Dr. Stone was talking about with the long-term care facilities, and after we vaccinated there, the rapid decrease in the number of outbreaks and transmissions, even though we're seeing these cases that were popping up, go to show that there's probably a significant effect on the ability to spread the virus. So again, I think I would just suggest that, obviously we get our vaccines. It's a little bit early now, such a small percentage of the population has been vaccinated. We've got kind of over the next month, maybe these concerns about another wave. After that, I would say stay tuned with, Public Health Agency of Canada and Public Health Ontario guidance on what we can do with respect to gatherings and masking, etc. Once everyone is vaccinated, and we'll have a better lay of the land at that point in time.
Great. So now on to the human nature side of the world. We've got a question here. What's your advice to people wanting to travel out of the country after receiving their vaccination? Are we all good to go?
Well,
Tony, you want to take this one? It's a tough one.
Well, only for a moment, because you just heard about emerging evidence around vaccine efficacy and reduced transmission, but I would still caution folks. We're all going to be living by the provincial and federal rules around interprovincial and international travel. So no surprise that there's a lot of caution right now, because even though we know that if you're vaccinated, you're less likely to get symptoms, you're less likely to transmit, but some people still can transmit. And so we're not in a risk-free environment. So I suspect that what we'll see is, both at the federal and provincial level, still a fairly aggressive approach until there's a lot of vaccination complete. I'll be surprised if that doesn't happen. Notwithstanding the CDC's guidance, I'll be surprised if federally and provincially we move quickly to relax the rules around what you're describing as this vaccine passport strategy. I don't have a line of sight to what they're planning. But I'm just telling you, I'm predicting or speculating that that they're going to want to be a bit cautious in the next 6 or 8 weeks and wait for much more vaccine to be distributed. But I don't actually know. Dan, you might have better intelligence than I do, but that's my thinking.
Yeah, I don't. I've not heard any sort of plans yet to modify the the requirements for travel and quarantine. I think there's still sufficient uncertainty again about these variants, which tend to be circulating internationally more so than in Canada now, and specifically those ones that might be vaccine resistant, that I agree with Dr. Stone that there's probably going to be ongoing caution, at least for a while. If things really settle over the spring into the summer, maybe we'll see some changes. If some countries have really great vaccination rates and are able to decrease burden, we might see something opening. Just speculating that if the U.S. continues in a downward trend with respect to cases and increasing their vaccinations, maybe we would see that border open up. But I think again, too early.
Yeah, so we'll all be excited for that. Some of us have children on the other side of the country, so I'm excited to get on a plane and go see them. On another more personal note, because we know that the spread is really happening within those circles. Life goes on and death goes on. And so there's a fine balance between the mental health of our family and loved ones and having to go through events that are traditionally quite emotional and sensitive to human interaction. So how do we manage those kind of balances between being safe and being at a funeral, for instance, or a family event that's a little more tragic?
Dan, you want to start?
Yeah, this is again a difficult question because there is this, and like you said, a balance, right? And I recognize, not everyone is equally able to weigh the risks and benefits, right? This is where things like vaccination will play a significant role when we're determining, just how safe is it to have a gathering, even if our numbers are, or if the provincial guidance is that we're now allowed to have, 10 people within the home, or broadening it, just how safe it is. And so I think it really does, it is very individual in that you really do have to look at your own circumstances. So who's going to be there? What is the risk that someone might import the virus into a gathering? Are there really vulnerable people there? So if you're at sort of are there a number of elderly family members that are very vulnerable? And then adding in the vaccination question into that equation: has everyone been vaccinated or not? And how do you consider? So I think it's easiest for me to think about this personally. My parents are a little bit elderly. We've got little kids here. They're not going to get vaccinated anytime soon because I don't think the vaccine will be available for quite a while. We're still quite cautious, looking for, actually, my dad is supposed to get a dose of vaccine today, and so that's good. But I think we're going to still be quite cautious, just with respect to gatherings. Normally, things like Easter would be a family gathering. I don't think we're going to end up doing that this year. I think we'll still, limit gatherings to potentially outdoors and with masks, at least until, everyone's vaccinated. We can be sure that the cases in the community are low enough. With funerals and other gatherings like that, I do think that the public health guidance, the way that the framework is established, or the recommendations in the framework, which kind of base on community risk of transmission, are appropriate, and they do make sense with respect to trying to limit the numbers, for instance. So the less people you bring in, the less likely that you are to introduce a virus. Now, again, that gets a little bit tough within your individual family. I think you have to make that decision within your family. I will say, though, that this is where you do want to think about vaccines. So, if you can get the highest risk people vaccinated at least. It's something that you were considering on doing anyways with respect to the gathering. This will potentially make it safer, but it's I think an individual risk. I don't know, Tony, if you're gonna probably didn't do a good job of really making it clear, but.
No, Dan, you did a good job. I'd like to make 2 points, and we are running out of times because there's something we didn't put in the slide deck that I wanted to flag as well. One is that certainly from a hospital perspective, the rules have been tough and not easy for people to live with, and we recognize that. And we really, I would say, we're sorry. We feel that the difficulties people are having with these rules. That said, what we have been able to do in our Lakeridge hospitals is really help to really minimize outbreaks because of those limitations. So, I would say to you that what I think we would look forward to is Dan, with his expertise and the IPAC team, as vaccines ramp up, they would also help us understand what is or is not okay and viewed as safe inside the hospital setting. All of the other descriptions Dan had around how are we going to behave with each other in the coming months. We're also eager to socialize and be together again. I'm just going to encourage folks to try to stick to the safety rules given the variants and given the possibility of a wave 3. And what happens is if it catches you, it's like the the condo unit in Mississauga, where those folks, their only interaction appears to have been sharing an elevator together. So it's almost like we just need to hang in there for a few more months to get vaccinated. The one thing I wanted to flag, though, that isn't in the deck is vaccine hesitancy, because part of our shared success here is going to be how do we help not only help people to make sure they have access to the vaccine, because that's a big concern, vulnerable populations. But what about those folks who are really on the fence? We know that that's an important number in our community. And, I know Dan and others have done some really good work on vaccine hesitancy, including a great YouTube video. And Dan, if you could share that, with the team. One of the other things we will look for the Board of Trade to do is to help us help others with questions. We know that it's really important for people to reach out to their primary care physician, learn everything they can about the vaccine safety, because lots of folks, with the newness of the vaccine, even with hundreds of millions of doses having been administered, I still hear it every day. And what I would say to you is if you have members on the Board of Trade who are hesitant, and members of the Board of Trade have a huge reach into Clarington, we need you guys to be part of this army and part of this solution for those folks who really still are wondering, is it okay for me? And where and how do they get information that would give them a bit more confidence and trust?
That's great. And we are 5 minutes out, so we don't have any other questions. With your indulgence, I'll just maybe ask if either of the docs have a final thought.
Sorry, there was an echo there. I think for final thoughts, I'll start and then maybe turn it over to Dan. I will say that Sheila, can I just get
there's an echo, yeah.
You could just mute for a second, maybe, or some. We really want to thank all of the healthcare workers in the hospital, in the community. It's been a Herculean effort, and folks have been working tirelessly, and we really have appreciated them. We certainly want to reflect that, the Board of Trade, represents and reflects a broad swath of business who's taken an enormous hit in the pandemic, and people who are suffering in other ways. And you talked about mental health as well. So people are taking major financial hit, potentially affecting mental health and family. It's been tough on everybody. We certainly recognize that. And I think one of the other things that we could probably think about beyond our conversation today, there are a lot of mental health resources that have been created and that are available virtually. So maybe the other messaging that we'd want to go out is please reach out to your primary care doc for resources if in fact there are folks who are suffering the effects of the pandemic from a mental health perspective. We want to make sure that we offer that help. Dan?
Thanks, Tony. I mean, I think that sums it up well, but I just maybe on a positive note, like we really are, we're getting close, right? It's been a long, long time. And even though I'm a little nervous about the next month or so into the spring, I mean, we see the benefits of vaccination and, and with the lockdown, the efforts of all community members really driving down those cases. And, I'm visioning a summer that is much better, and going into the fall and winter that's much better. And I think Tony's comment that having everyone pulled together from the community, over these next couple of months here, trying to get as many people vaccinated as possible, spreading the word about it is going to be really important, right? To just getting back to, even if it's not normal in the next couple of months, getting much closer, getting back out there. And of course, with respect to your businesses, it becomes very important as well. So I think, let's keep going a little bit longer, and we're almost there. I think it'll be brighter days.
That's great. Well, I want to just reiterate our gratitude for you agreeing to come and speak with us today. It's been very enlightening for myself, and I'm sure everybody else on the call. With your permission, we'd like to share this broader. Take advantage of us. We've got a large network that spiders out into the community at large, and we're happy to spread the word. I guess at my demographic, I won't need to roll my sleeve up because it'll be summertime and I'll be wearing a short sleeve, so I can just like pull up and run through. But I encourage everybody to do your part, continue to stay safe. Remember, we are here together, and so as a collective organization, we're here for each other, and we're here for the healthcare system. So please take our thanks back to everybody at Lakeridge Health and beyond for all they've done, for all you're doing, and have a safe day. Get outside. The sun is beautiful. It's a safe activity to do. So with that, we will go, and thank you everybody for joining us this morning.
Thanks for having us. Bye, guys.